We talked about it, very important, we know mastitis, cracked nipple, hematoma. Now the word is subinvolution. Involution means returning back normal. Subinvolution means failure of the uterus to going back normal. Involution means returning back. Subinvolution, uterus is not returning back within 6 weeks as it was going back. What do you monitor for the mother? Data collection, bleeding, normal uterine pain on palpation, uterus size, that means you will feel is bigger. What intervention you will do? Monitor vital sign because mother is still bleeding, and frequent voiding. Voiding is always good in your answer. And what medication do you give here is called methergine. Underline the word methergine. Methergine is also for contraction, but it says here methergine, but write down underneath, only given after the delivery of placenta. That means baby is born, placenta, methergine never used before, only after baby is born and after the placenta came. You will use methergine for contraction. I will move on the next page, some more medication. Most of them we have done. We already talked about Pitocin, and what is Pitocin is called oxytocin. Underline that. What does Pitocin? Contraction is okay, it does. But also, why do we use Pitocin? To postpartum bleeding, to stop the bleeding. And second line, for milk let down process. The breast milk, it's coming out, and because of its contraction. Also, you're using Pitocin for inducing labor, when we have to induce labor and bleeding. Adverse reaction. What do you monitor when you're giving Pitocin? Number one, hypotension. And rebound hypertension with high dose. And bleeding, postpartum bleeding. Bleeding can be also. And hypertonicity, which is in the beginning, that means your contractions are coming too fast. When you see the word mother is having hypertonicity, means is for the uterus is having hypertonic, and that means the contractions are coming frequently, you need to stop. So it can increase. Intervention, what do you do when you are giving Pitocin? Monitor fetal heart rate, oxygen is good. Hyperstimulation means again, stop Pitocin, and monitor for water intoxication. Sometimes it can lead to be too much of fluid retention. In third line, you can also use for postpartum bleeding, which I said methergine in the next line. And I said methergine not to give before delivery of placenta in the next line. So when do we use methergine? After the placenta came, after the baby came and mother is having problem in contraction, you can give instead of Pitocin, methergine. Intervention, monitor the blood pressure, vasoconstrictor, and also notify any pain, shortness of breath. Tocolytic medication are, why tocolytic medication? To lower the contraction. What are the medications you have? Terbutaline or breathine. And also some question I came across. If you are giving breathine, and there was a question, when do you stop breathine giving? When mother is dilated 4 centimeters. So mother start dilating, that means your contraction, you need to stop, because what was it doing? It lowering the contraction. So on the top with breathine, write down, after 4 centimeter mother is dilated, stop giving is breathine. And I said earlier, tachycardia is bad side effect of the medication. Nifedipine or Procardia is a blood pressure medication, but they can also use it. And Retrodine, another medication, are used it. Next is you have betamethasone. Now yesterday, betamethasone, I said lung maturity. Remember the word, those who were here, is we do the test, LS ratio test, and 2 in 1 is normal. If any question, early baby is coming out and they're saying LS ratio 1 in 1 or 1 in 2 is low. Only you will see the lungs are mature when your lecithin level is 2 in 1. So tocolytic medications are giving. Why do you give betamethasone? Underline the word to increase surfactant for the lung maturity. And I want you to write down LS ratio. This is normal. Less than this, baby's lungs are not mature. And what do you give them? Betamethasone. For preterm baby, mother is 28 to 32 weeks, and they give, and is given at this time of gestation. And adverse reaction are, what do you monitor? Is blood sugar, because it says steroid. So right down on the side is a steroid, so sugar will go up. And infection and edema, add the word infection. Whenever you are giving steroid, the risk of infection, sugar, and edema. Next line, lung surfactant. Lung surfactant is given to treat hyaline membrane. Hyaline membrane, any question you see, is a severe breathing problem. Lungs are not mature. Child is having hyaline membrane, what are you monitoring? Respiratory. What are you going to give? Lung surfactant. And what are you monitoring? Respiratory distress. Intratracheal route. How do they give lung surfactant? Through the tubing, intratracheal. And after they give lung surfactant, no suction for 2 hours. Why? And monitor for pulse and monitor for oxygen, but do not do suction. So everyone, betamethasone is used for lung surfactant. It's a steroid, so monitor for infection, monitor for sugar, and monitor for edema. Betamethasone is a steroid, lung surfactant to given when the child has hyaline membrane. That means there is a membrane obstructing and they cannot breathe. Hyaline membrane is a respiratory severe distress, and they can give them. And why do you give is surfactant? To expand the lungs so baby can breathe. So remember, lungs to expand and make breathe and help them baby to breathe. I added one word here, is bronchopulmonary dysplasia. Babies, when you put them in too long mechanical ventilator, and the complication, because they are breathing, they are opening their lungs, they damages the lung also. So what is a complication for prolonged mechanical ventilator? Or bronchopulmonary dysplasia. That means the lungs are damaging. The third word, I wrote it down here. As I will move on the baby's head, we will add this word. But you guys can add broncho. So in case they say baby has been for too long in the ventilator, what does it happen? Is they're not open, but we are opening, but it can also damage. So complication of mechanical ventilator is called bronchopulmonary dysplasia. The lungs are getting bad, and they will have automatically the breathing problem. So those few things I added here, I want you guys to be aware. Some of the things are. Now I'm moving. I have few things here. And make sure everyone, there are a lot of questions in growth and development. 6 months baby, 10 months. When they're doing what age, I had in the peds note, but newborn baby is born. What is a normal baby's respiration and heart rate? We must know. 100 to 160, 30 to 60. And why? Because they throw the question, mother had a baby, and they gave you the respiration, and they said, can you have your CNA help you to help the mother with the baby? If child is normal, is okay. And why they're giving normal vital signs, so you know the child is normal or not. Are we clear? So we must know heart rate, we must know respiration. They gave the length of the baby. What is the length of the baby? Is 18 to 20 inches, the normal. 19 to 21 if they give, that's okay, and that's normal. Weight they give, what is the normal weight of the baby? Is 6 to 9 pounds or 5.5 to 9.5 pounds. Less than that will not be considered normal. And head circumference they gave, it comes in the exam. Why head circumference? Because if it is bigger, the baby is sign of hydrocephalus. So you monitor, make sure you guys all know. Now the next thing I want you to add here in the head, the word is molding. What is molding is overlapping of the bones. When you see the baby's head comes out, it doesn't look all rounded. A lot of time it look longer, different shape, and that is normal. Molding word, overlapping of the bones. And that changes the shape of the baby's head. And that's normal. Overlapping of the skull bones. I added, so you will know we are talking about the head. And in 72 hours, they become normal. So it gets okay. So what is molding is when the baby's head, the bones are so soft that when the head is making its way, overlap the bones. Are we clear? So that we all should know. Next to wording we all should know for NCLEX, caput succedaneum. What is caput succedaneum is edema of the soft tissue over the bones, in the skull bones, where we are talking about the baby's head. So what is caput succedaneum? Edema of the soft tissue. But very important line is here. It crossing the suture line. The meaning is if the swelling is here, these are the suture line and it goes on the other side. Are we clear? So what is caput succedaneum? The swelling. Swelling can go on the other side. So what are they crossing? Suture line. That's a key answer. And so you must know caput succedaneum, there's edema on the baby's head, and what happened in that edema? It should subside, but is crossing the suture line. And also, it's normal, but it takes few days. We don't have to do anything, but there is a swelling on the baby's skull. But what is cephalhematoma? Hematoma means there is a blood, and swelling caused by bleeding. And why there is a bleeding? To the periosteum, and it does not cover. Maybe when they're using forceps. Are we clear? Maybe the vacuum, they're pulling the baby. And what can it lead to? The bleeding. So everyone should know the word is molding word, caput succedaneum, and cephalhematoma. Cephalhematoma does not cross the suture line. That is the difference. Cephalhematoma cross the suture line. But cephalhematoma is not crossing the suture line. Make sure we all know that. And absorb within, not in days, it takes about few weeks to disappear because it's a blood. Then we have Apgar score. Normal Apgar score, 8 to 10, you don't have to do anything. 4 to 7, yes, is keep gentle handling. Oxygen. But 0 to 3, resuscitation. Everyone is okay? Apgar score, newborn baby you're monitoring. And what are you monitoring? It says underneath, heart rate, respiratory, muscle tone, reflexes, and skin, and how long you're monitoring, 0 to 2 points. And then you count it, and you're monitoring the baby for Apgar score. So everyone should know cephalhematoma, molding word, and this word, and Apgar score. Next page is fontanelles. We all should know. Where is your anterior fontanelle? In the front. Posterior is in the back. And anterior fontanelle shape, I want to highlight the word diamond shape. And they're flat and diamond. When does anterior fontanelle closes? 12 to 18 months. If it didn't close, or they close early, you got to report. And that's the way they put the question. Child has anterior fontanelles, child is 3 years old, and anterior fontanelles are not closed. You got to report there is a abnormal growth and development. They must close timely. If they did not close, there is something wrong with the child. Posterior fontanelles are shape of triangular. And when do they close? 2 to 3 months. Then eyes. Eyes are crossing of eyes are normal, and because of the muscles are bad. And that is called, remember the word strabismus, when you are crossing eyes in the baby, is normal because the muscles are weak. Ears, if the ears are low set, you're looking for Down syndrome. Mouth, Epstein pearl are white cyst, they are normal, and you don't need to notify, and that would be normal. I want you to add there with the eyes and Epstein pearl is the word is called vernix. Vernix is normal in the babies. And what is vernix? The white cheesy material the babies are having. So remember, vernix, the child has vernix. Vernix is white cheesy material. When you see the newborn baby, they are covered with the white cheesy material. And what is the word is languge. I want you to write down the fine hair. Languo is fine body hair. So babies are born with fine hair. That's called language. And vernix is cheesy material. That's normal. Now, sometimes your questions are, and they throw this wording, and they say, which are the normal for the babies who are born? So we all should know vernix is normal, and eyes are normal, crossing up Epstein pearl is normal, and sometimes the babies are having milk coming out from the breast. That's normal because of hormones from the mother are still in the baby, and that's normal. You don't have to do, and they use the word is hazel milk is there. Is the milk is hazel with milk and is the for the milk, and that's normal. A skin, vernix caseosa, dark red color. So the next is the vernix caseosa you have on the skin. Dark red color is common with the premature baby. Highlight that word. Dark red color is normal with who? With premature babies. Cyanosis is common with hypothermia, hypoglycemia, respiratory, and neurological is not normal. You got to notify. Common with all these diseases. But when the word comes is cyanosis, that means could be these are the reason, and you need to notify. Acrocyanosis is normal. Highlight that word. What is that? And sometimes they don't give acrocyanosis, and they use the word is what? Peripheral cyanosis. Peripheral, their extremities are blue. Babies is born, they didn't give word acro, and they said baby's peripheral area is cyanosis, is normal. Because first few hours after the birth, infants are cold because of poor perfusion and blood to the periphery of the body. So remember, the word is periphery. Everyone is okay? And acrocyanosis, that means their extremities are blue, but that's normal because the circulation and maintaining the temperature. But the word is cyanosis, other word for breathing problem, then it's not good. Now, Harlequin sign. What is Harlequin sign? Dark pink or red color on one side, while the other side is pale, and that would be sign of cardiac problem. So you got to notify. So which one you need to notify? Cyanosis word and Harlequin word. Acrocyanosis is normal. Now next is umbilical cord. We already said earlier, check for the cord, 2 arteries and a vein. Cord can be clamped at least for 24 hours. Cord care is important for NCLEX also. Is remove the cord and until it's dried. Antibiotic is okay to apply. Triple dye is okay. Clean with water and wash with soap and water, and monitor for infection. For the cord, you're monitoring for infection. Diaper, fold away from the cord. Don't let it touch. Sponge is good, then giving more bath. Sponge bath is good. Circumcision care are petroleum gauze to the penis, except if they give you the word plastibell is used, then you don't apply. Remove the petroleum gauze, and after voiding, what do you monitor for infection, for bleeding, and clean after each voiding, and milky covering over the glans, penis is normal. We do not touch that, and monitor for voiding. So circumcision, after they come back, you monitor for bleeding, and you monitor for the child and cleaning and infection. Newborn baby. in the hyperbilirubinemia is first day indicate pathological process. What is here bilirubin? Is more than 12, is not good. And what do you prevent? Bilirubin question you prevent from, underline the word, kernicterus. What is kernicterus is permanent neurological damage. So what is bilirubin is affecting here is bilirubin affecting neurological problems. So what do you prevent the babies for hyperbilirubinemia is kernicterus. What is kernicterus is neurological damage. Data collection, monitor for jaundice. Any question, the mother, the baby's bilirubin is high, what do you do as a nurse? Remember, is you start the feeding. Jaundice, bilirubin, liver, hydrate, intervention. What do you do when bilirubin is high? Maybe answer hydrate, or maybe frequent feeding, or mothers start breastfeeding. And why? To hasten the passage of meconium and excretion of bilirubin, or you can write down on the side, to lower the bilirubin level. How do you lower the bilirubin level? Now we all talk about phototherapy, but in a lot of questions I start the feeding baby right away. Are we clear? And very important word here, kernicterus and neurological problem. Next page, you will go on fluorescent light. When the baby has fluorescent light, is you put them in the light, and what do you monitor the babies are? Dehydration, very important, deprivation, sensory. What is the meaning sensory deprivation? Mother is not able to hold the baby, so they can touch the baby because they are not taking out the baby from the light therapy. So some questions are how they word it. What do you monitor with the light therapy? Not all the time are, they will say close the eye, but sensory deprivation. What do you increase here? Fluid. Why? Because of the light they can get dehydrated. So highlight that. Exposure to the skin, and monitor the skin for breakdown. Close eyelids and remove the patch from eyes every shift and inspect the eye. So remember, cover the eye, baby has a diaper and only eye patches. Increase fluid, check the skin. If it gets bronze baby syndrome, that can be because of the light. So check the skin. Increase fluid. And in the last two lines, reposition the baby frequently. So any questions on light therapy, phototherapy, turning them important, cover eye, have a diaper, fluid is important, check their eyes and check their skin. Erythroblastosis fetalis is destruction of red blood cell. And second line, it lead to, when the red blood cells are dying, it lead to anemia, hemolytic anemia. And then anemia leads to jaundice before 24 hours. Then intervention or you give them is RhoGAM for them to prevent erythroblastosis fetalis. Now next is you have preterm babies. Babies are born before term, before 37 gestation. Underline the word preterm babies are immature. They're not mature. What are the data collection are? Highlight the main wording. Jaundice, number one. At the end, minimum subcutaneous fat tissue. And lineage on the skin is there. Woolly patches, like a small hair on the head and the woolly, like a small hair, the patches. And very important, their extremity, they keep them extended, but do not flex them. One of the signs is for premature baby, many questions, they keep their extremity extended. They do not bend them. So that's called extension is on extremity extended but do not maintain flexion. A creasing of the sole and the palm are minimum. Temperature is below normal. What do you do intervention? Monitor vital sign, cardiopulmonary function, weight is important, very important, keep the baby warm. and infection. To answer, premature baby, keep them warm, prevent them from infection. Very important answer was keeping the extremity open. That's one of a lot of questions, you will see that. And how do you feed them premature baby? Add underneath them by NG tube and TPN. They have no energy to feed them regularly. So what do you do when the babies are premature? Feed them with NG tube or TPN. Postpartum means they're bigger babies and more than their time. And underline the word, first line, they are wasting of fat and muscle. They're losing a lot of fat and muscle. Second line, fingernails are long. Hypoglycemia. Intervention, monitor for hypoglycemia. Even postpartum baby, temperature is important. Now small for gestational age, they're very small babies according to their age. What do you monitor? Fetal distress, second line. And the word is called polycythemia. Ruddy appearance. Poly means everything is more, all the cells are higher, and the colors look more ruddy. That would be one of your answers. Intervention, airway. And hypoglycemia, give blood glucose. Feeding, you give them. Monitor for aspiration. Large babies, when they're big, second line, birth trauma. They can lead to what? Birth trauma. I want you to go on the next page now, and that is more last, but I like a few things to add on there, is respiratory distress question in the newborn babies are. Any lung problem, or they don't have immature lung or surfactant are poor. What are the signs in the babies are respiratory distress syndrome or nasal flaring. Underline the word nasal flaring and hypothermia, and very important second word, retraction. Everyone must know the word retraction. What is the meaning retraction? When they're breathing, they're using their muscles. And what muscles are they using? They did not throw the word in with the retraction, but some question they will say is retraction. Retraction of what? Intracostal muscles. Whereas intracostal muscles are in the chest, between the ribs. So when you see the baby, anybody with a breathing problem, and they're using the chest muscle, that means they cannot breathe, and they are struggling to breathe. What is one of the bad signs of respiratory distress is, the word is called retraction. What is retraction? Is intracostal muscles are going in. Child or patient is using the chest muscle. Another word they will use, a sternal retraction. A sternal is our sternum here, and they're going inward. So they're taking hard time to breathe in. Everyone, all your question, respiratory distress syndrome is not necessarily lungs problem, could be any other problem. And child is not able to breathe. And how they're trying to breathe? They're struggling to breathe. They're nasal flaring, and the word is retraction. And what are they retracting? The chest muscle. And remember the word hypothermia and hypoxia. They're having cyanosis, tachypnea. What do? Monitor the color and monitor ABG. Now in the intervention, second line is called eye exam, when you are giving oxygen. So what did you do? They're lacking oxygen, and how you are treating the babies with respiratory distress syndrome, you are giving oxygen. Too much of oxygen, what do you monitor the child, or underline the word eye exam, retinal damage. Too much of oxygen, they can damage their eyes. So you got to keep monitoring the child with oxygen. Respiratory therapists, they can do CPT, vibration, and also nutrition. So everyone, the respiratory distress, nasal flaring, and retraction word is important. Retinal damage, eyes, especially in the babies. Too much of oxygen can cause retinal damage. Hepatic system in the liver is affecting jaundice and appears 24 hours. Full-term newborn babies, 48 hours, premature neonate. Physiological jaundice peak, 5th day of life. Jaundice before that time is 6 to 7 and is pathological jaundice. Physiological jaundice is good. Pathological jaundice is physiological if it comes before. So in the first line, physiological jaundice comes first 24 hours and 48 hours in premature babies. So normally 6 to 7. If they have more than that, you start feeding the baby. Jaundice, what is the meaning of jaundice? Underline the word destruction or hemolysis of red blood cell. And prevent the child from acidosis. Highlight that word. Liver store iron only for 5 to 6 months is normal in the babies. And neonate is risk for hemorrhage. Why? Because they don't have vitamin K. How much vitamin K you can give them is 0.5 to 1.0, and IM you give them, and the needle size is 25 gauge. I want you to add there 25 gauge needle, G-A-U-G-E, gauge needle, and 90 angle, because it's a IM, so 90-degree angle you're using that needle. And you can give them in vastus lateral. Lot of questions are thermal regulation. We all know simple word, keep the baby warm. But we all need to know this way. Newborn babies do not shiver to produce heat. So we got to keep all newborn babies very warm, and how to prevent them from heat loss. Number one, heat loss prevent by, number one, evaporation. What is the word evaporation? Underline the word, keep the baby dry. Highlight that word. And wrap the baby. That means don't keep them cold for longer time. Don't keep them wet. And so what happened, the body fluid is evaporating and they're losing what? Heat. So how do you prevent evaporation? Answer is keep the baby wrapped with the blanket and keep them dry. Radiation means how do you prevent the heat loss from the baby? Is away. Highlight from cold object like wall. Walls are very cold. You're close to the window. What happened? You're getting more cold. And how you're getting? By radiation from one to another. Convection, third one. Now the evaporation, first radiation, and then the convection, keeping the baby away from the draft. Conduction, a lot of questions you will see. All the treatment on warm padded surface. And there was a question. The nurse is taking a baby's weight and not using anything on the weighing scale. What is baby is losing? And answer was baby is losing heat by how? Answer was conduction. Are we clear? So what do you have to do? Don't put the baby anything, you're going to use something on the top to prevent the cold surface. Are we clear? Very, very important these wording for your exam are, you guys have right here, but you must know. Don't be surprised the word anytime they throw with the baby's evaporation word and conduction. Conduction means anything you're doing, you must use something on that surface. Are we clear? And you're preventing warm padded surface. Now the reflexes are sucking and rooting reflex. All your reflexes are disappearing around 3 to 4 months of time. If it persists may persist for 1 year, but sucking reflex. When babies are, remember, they're born, they have a lot of reflexes. And those reflexes, they start disappearing, but sucking, rooting reflex are there till 1 year. Tonic neck reflexes. Tonic neck reflexes disappear about 3 to 4 months. Now remember, what is sucking and rooting? When you bring a bottle and the babies can touch and they can get the nipple, that means the rooting reflexes. Now when they are saying is tonic neck reflex, what is tonic neck reflex is? Now when you have a loud noise or something, what happened? The babies turn the head to one side, they turn the head to this side, and they extend the arm, they extend the leg, and the opposite side, what they do? Flexion. So one side they flex, other side they do is extension. That is your more tonic neck reflexes. Disappearing by 3 to 4 months. Palmar plantar, palmar the hand, when you bring something and they curdle their fingers and they hold it. Palmar, when you're bringing, they bring their feet and they're holding. That's the reflexes. Moro reflexes. Moro reflexes also is when you have a loud noise. What happens is they will go, their hands will go like that, and they will bend them, and they will, their fingers are open, but what do? This finger and thumb like C shape, like this, they will do it. So that is a Moro reflex. So these reflexes, very important. You guys have it all with the pictures in your foundation book. So this is in the foundation. I love to get all over and read it. And so you guys, if you're looking in your OB section, in your foundation book, you have in mothers and newborn baby, and they have showed all the reflexes. So if you have it, just look and know the really how this is the one is the Moro reflex. This is the one is when they are turning their head and extending. The Moro reflex is basically they're extending and they fan the fingers, and this index finger and thumb, they're turning on the side. They go like this, and that's called Moro reflex. But remember, these reflexes are disappearing. In your mind, think about all are disappearing 3 to 4 months. Are we clear? And plantar reflex, which is on the foot, this within 8 months. Moro reflex, if it persists more than 6 months, underline that. Moro reflex, the one I was saying, they fan their finger and they turn like that. That's a Moro. If it persists more than 6 months, is reason could be indicating brain damage. Underline that. Babinski reflex is very important. And what is Babinski reflex? When you toe on their foot, you will do, they fan their toes and their finger. That's your Babinski. Babinski reflex should, this is the last one, will disappear when? About 1 year of age. And when does it come back? ICP. It's a sign of ICP. What is ICP? Intracranial pressure. Head injury patient. Anytime your Babinski reflex is returning means is what? Patient, what are you monitoring is ICP. What are the 3 signs when I talk about in neuro is ICPR. And signs are ICP is number 1, Babinski reflex. We all should know. Babinski reflex is back, and that should disappear 1 year. Patient fell, patient has head injury, and patient has positive Babinski reflex. What are you assessing? Neurological. What are you assessing? ICP. That's one of the signs of ICP. What is another sign of ICP is? This is a late sign. Remember, the word is called decorticate. And third one, decerebrate. Decorticate is when their hand goes like this. That is decorticate. And decerebrate away. So these are all 3 signs are very important for you or for us to assess is late sign of ICP. Everyone is okay? Is late sign of ICP. I want to, definitely you guys must know all this, but I want to add few things because a lot of questions are coming for you guys are in condom catheter, and someone is using condom diaphragm. I want you to write down few things on this page. Even you don't get time, at least you guys will have, and you will know something is diaphragm. If someone, female, is using a diaphragm, what does the diaphragm can lead to be? Number one, what is diaphragm can lead to is toxic shock syndrome. Toxic shock syndrome. And clean the diaphragm after each use in your question and remove it after 8 hours. And do not use diaphragm when you're having a period. Okay, so what do you monitor someone who's using diaphragm? Their risk for toxic shock syndrome. What are the signs of toxic shock syndrome are low blood pressure. So write down the word is low blood pressure, fever they have, and also they have dizziness. Okay. Condom, when man is removing, when they're removing, remember, the best is when the penis is erected. The same time should be remove the condom in your teaching question. When do you make sure the diaphragm is fitting? And when do you change the diaphragm or refit it? When the patient gains weight or lose weight. What is the weight average here? 10 pounds. So make sure you guys write down. Is if someone gains weight, 10 pounds, or they're gaining or they're losing 10 pounds, they should be resized. Had abdominal surgery or has a baby, that affect a lot. So make sure in your question, abdominal surgery question, and if somebody had abdominal surgery should be changed, had a baby, and some question they will give you is this. What do you monitor when someone is using diaphragm is toxic shock syndrome. Now pills, when we are using the pills are oral pills. If you have a diabetic patient, what is the best for diabetic patient to use? Pills or diaphragm? What would be the best for diabetic person who is diabetic and they want to prevent the pregnancy? Would be good for them is your diaphragm. Why? Is pills are hormones and affect what? Blood sugar. Are we clear? Yes, you do have to monitor other things. Infection, cleaning is important, but oral pills are, what does it cause? Oral pill affect the blood sugar. Are we clear? So remember, hormonal method are for your pills are take every time pills. And what happens if you're taking antibiotic? It loses the effect of your medication. So you need to use that. And so remember on those questions, some of them they are giving vasectomy. Men, females, we have tubal ligation, but the men, they have vasectomy. Do you think they're 100% they will not be able to produce kids? No. And so what do they should do it? They should get their 3 semen tested before, otherwise you should be protecting in your questions, okay? So semen must be checked, make sure they are not having any sperms, because it's not 100% that they will not get pregnant. See how your questions are, a lot of questions here and there, and so I like to just make sure cover few things when I see something you may not know. So 3 tests is important. vasectomy is not completely right away you think you will be protecting to have a baby. So we'll stop here, and you guys have done the question, and you would be needing to do the questions. If anybody wants to get the questions, so we stop here. We have done all OB, and everyone do your questions, and if you do